Fine. So good evening, everyone.
Good evening.
And I'd like to thank all the esteemed panelists as well as the delegates who have joined us this evening. Very important webinar, which is basically on a CovidCare platform. And we call it Trace, Manage and Monitor. And as all of us know that in these COVID times, it is very, very important to stay safe, not only for yourself, but also for all your dear and near ones. And while the Unlock 2 is under progress, we need to be far more careful, and we should be using technology to make sure that are we infected, nor do we infect others. And in case we do get infected, unfortunately, how do we manage and monitor it with all the specialists?
Yeah, it's fine.
I will now like to kickstart the webinar by first of all welcoming Dr. N. Subramanian, who's the chairman of the Health Committee of PhD Chamber of Commerce and Industry, the director for medical services at the Indraprastha Apollo Hospitals, New Delhi. I also thank Mr. Prem Sharma, founder and CEO of DayToDay Health, for us, who will be apprising us about the technology. I'd like to thank Dr. Vishnu Vardhan, operating officer, again from DayToDay, to answer a lot of queries which we might have. I'd like to welcome Ms. Yvonne Biggins, mental health and well-being lead at DayToDay Health, because as we into the COVID-19 and the post-COVID-19 scenario,
Vivek ji, please request everybody to mute, so only the speaker to unmute himself and do it, so that we have no disturbances.
Sure. So I'll request the panelists once again to mute themselves. So as I was saying that once we are getting deeper into COVID and post-COVID era, there are issues which are coming up which are related to mental health and well-being, which is a very, very important aspect or a fallout, if I can say so, out of the COVID-19. And we have Ms. Yvonne Biggins to throw light on that. And we also have our managing committee member, as well as the president and founder trustee of Social Action Foundation, Dr. G.L. Agarwal, who will be also talking about, how from a social perspective, from his NGO perspective, as to what all have they been doing. So a warm welcome to all of you. And I will request my colleague, Dr. Ravi Rathod, to quickly read out brief profiles of all the panelists before I request Dr. Subramanian to give a welcome address. Over to Ravi.
Thank you so much, sir. I'll begin with Dr. Subramaniam. Dr. Subramaniam is the medical director at the Indraprastha Apollo Hospitals, Delhi, where he joined as a senior consultant urologist in October 1995 and helped to set up the state-of-the-art Department of Urology. The Apollo Hospital is the largest healthcare group with over 72 hospitals and over 9,000 beds, providing state-of-the-art tertiary care services across 50 medical specialties. Dr. Subramaniam also serves as the chairman of Healthcare Committee of PhD Chamber and as a co-chairman of Health Committee of FICCI and as an advisory council member of People to People Health Foundation. He has also served as the president of the Rotary Club Foundation, Rotary Education Foundation, and as the executive vice president of the Rotary Cancer Foundation. He is also a trustee of the Neuroid and Research Foundation and the Samriddhi Foundation, and is the chairman of Emirates of the Rotary Delhi Central Charitable Trust. Welcome, sir. I'd like to introduce Mr. Prem Sharma, who is the founder and CEO of DayToDay Health. He is an entrepreneur, business and technology leader with a proven track record in managing technology for high growth companies, and he is passionate about growing business, working with great people, developing compelling product, delivering results, and building and leading stellar product and technology teams. Mr. Prem Sharma has a strong background in developing technological products for a variety of industries, which includes healthcare, e-commerce, CRM, consumer, internet, mobile. He is also co-founded UB Cabs in 2011. That is a cloud-based aggregation platform for the taxi industry. He has a personal interest in design thinking and innovation management. Mr. Prem is an alumnus of the Solon School Management, Massachusetts Institute of Technology, USA. Welcome, sir. I'd like to introduce Dr. Vishnu Vardhan, who is the Chief Operating Officer at DayToDay Health. He is an orthopedic and ballistic trauma surgeon. Turned healthcare entrepreneur. As a surgeon, he has worked in Aditya Birla Hospitals, Apollo Hospitals, Fortis Healthcare, and United Nations Support Office for over 20 years. Dr. Vardhan brings an expertise in healthcare management, strategy, PLN, clinical operation, and digital healthcare. He has done extensive work in behavior economics, game theory, in solving healthcare problems. Dr. Vishnu is an alumnus of the same Solon School of Management from USA. Welcome, Dr. Vardhan. I'd like to introduce Ms. Yvonne Biggins, who is the mental health and well-being lead at DayToDay. Over the last 15 years, she has worked within the education and innovation roles in companies like Apple. She also co-founded 2 education startups. That is, Yvonne holds an MBA from the Cranfield School of Management. She's a master in applied positive psychology from the University of Pennsylvania in US, and has also trained at the THNK School for the Creative Leadership. Welcome, ma'am. I'd like to introduce our former managing committee members also, Dr. GL Agarwal sir, who had a 42 years of professional experience as a promoting partner of GL Agarwal and Company, chartered accountancy firm. He is also a president and founder trustee of the Social Action Foundation, NGO. Dr. Agarwal, he's a great Indian legend by Indian culture, has got several awards, which includes a great Indian legend by Indian Cultural Association and Gold Seal Records, UK, a celebration of 300th birthday of Khalsa and Millennium Awards in 1999. He has also get a special award by Parliament of Vishwa Dharma, Nepal, in occasion of Vishwa Dharma Sansad Satabdi in Nepal. Dr. Agarwal has got a special award by the Chief Minister of Delhi as social activist at Parliament Annexi, and in the function organized by Dr. Rajendra Chintan Samarthi in December 2002. Welcome, sir. Thank you very much, all the eminent panelists to join us. I would like to hand over to Mr. Vivek Sehgal, sir, now.
Thank you, Ravi, for those introductions, which were quite a mouthful, for all the wonderful panelists we have this evening today to discuss COVID care, of how do we manage and monitor this particular aspect. May I request our chairman of the Health Committee, Dr. Subramanian, to kindly give a formal welcome to our panelist, Dr. Subramanian. Kindly unmute yourself, Dr. Subramanian.
Thank you very much. I think it's a complete delight to be a part of this wonderful afternoon when we are got a wonderful collection of people from different dimensions who bring different strengths. Mr. Prem Sharma, the founder CEO of DayToDay Health, Dr. Vishnuvardhan, who I see has done several things and is now, we will gain from his experience today. Dr. Girdar Lal Agarwal from the Social Action Foundation with a long experience, and Ms. Yvonne Biggins, who brings in a very, very important dimension at this point in time when we are all contending with the difficulties associated with the COVID management, the one of mental health and well-being. The PhD Chamber of Commerce and Industry has been working as a catalyst for the promotion of the Indian industry, trade, and entrepreneurship for over 115 long years. A forward-looking, dynamic pan-India organization. It's a partner in progress with industry and government, with special focus on MSMEs, works at grassroots levels, the strong national and international linkages for propelling progress and harmony, leading to integrated development of the economy. The current pandemic has been very stressful and unprecedented state when put a huge strain on the healthcare system, taking place at a time when we were also on the parallel running with technological optimism and promise through digitization of health data and technologies. The digital services, they not only change the way we communicate, but they also offer us mechanisms of monitoring health and well-being. Innovating in digital health can help us in reducing the inefficiencies to improve healthcare delivery, improving the access, reducing the costs, improving the quality, and in the long run also makes care of healthcare delivery becomes more person-centric or personalized medical care. The coronavirus disease, which has really hit us very strongly, we know spreads through droplet and contact transmission. Therefore, identification, isolation, testing, tracing and quarantine have become extremely important mechanisms to reduce the transmission, in addition to the social hygiene, social distancing, and COP etiquettes. Apart from tracing, isolation, and remote monitoring, it also plays an important role in preventing the spread of the pandemic. Remote monitoring platforms can help in identify and assess potential at-risk populations, deploy outreach and community care plans, monitor and educate patient populations. And when we enable these assessments, the care protocols could help us to reduce the risk of exposure to both the patients, the healthcare professionals, and the community at large. Remote patient monitoring allows all of us to stay connected with those suffering or those diagnosed to have COVID, monitor the changes pretty closely, and also help us with remote consultation with specialist doctors. So today we have this outstanding team of experts who will be talking to us today. So on behalf of the PhD Chamber of Commerce, ladies and gentlemen, let me welcome you all once again for what I'm pretty sure will turn out to be an outstanding afternoon. Thank you.
Thank you very much, Dr. Subramanian, for those wonderful opening remarks and the importance of technology as well as the expertise which today Ms. Yvonne is bring the table considering the post or rather mid-COVID and the post-COVID era. I would now like to request Mr. Prem Sharma to kindly tell us more about this technology, because as we understand today that it's the important role of technology which is going to be a major safeguard mechanism for the monitoring and managing of a crisis or a pandemic like this. Over to you, Mr. Sharma.
Thank you so much. Thank you so much, Vivek. And I'm very honored to be part of this esteemed panel. Before I start talking about, what DayToDay and is what is our product, the one thing which I would like to highlight is that there is something very, very interesting we are seeing, a big shift in how we even talk about COVID. So if you think about in any other healthcare problem, we talk about, okay, going to hospital or getting operated or going to doctor and getting some treatment. But now we are going back to basics. We're talking about changing the behavior, thinking about the healthcare as a system, and then use the doctors when needed. So which means like this pandemic has pushed us again to think about healthcare as a system, not a transaction between a doctor and a patient, whether it's a consultation or a surgery or a treatment or anything else. How do we prevent? How do we monitor? And then when required, how do we intervene? And those are the fundamentals on which good healthcare should be built on. And those are the fundamentals on which we have built DayToDay. So I have a very short presentation to just give a little bit of a look and feel of what we do at DayToDay about COVID. I'm focusing very, very specifically on COVID because that's the topic. What is it today? We are a virtual acute care management company. We have a digital first approach to help the patients in their acute care journeys, which means somebody going through very complicated cancer treatment or open heart surgery or a hip replacement or any complicated episodes in the life, we help the patients completely remotely with the digital first service. In case of COVID, we are giving everybody, by everybody I mean hospitals, doctors, organizations, families, right tools and support to fight COVID. And what do we do is like, we are working on organizing, or we are organizing the care ecosystems at large, where the hospitals, the doctors and the patients, they are all linked and working in a care ecosystem. So what is our integrated program? So if you the situation is that 80% of the cases are presented with the moderate symptoms, and they can be managed at home in isolation if you have the right tools. If we don't manage people at home, there is a risk. Hospitals have a very limited infrastructure, and we are already seeing the overflow. Our clinicians are at risk of infection, and the families are not prepared to, and they don't even know how to deal with the situation. Like we are hearing the news from our community when somebody has died and the relatives can't even go and see the person. So it's not like, as a society, as a family, we are not prepared. So everyone is as a risk if we don't think about how do we manage all these things in isolation. So what do? We manage the entire process for COVID, right from the app to moving people to the hospital when needed. And we have our clinicians behind the scenes supporting and triaging the patients. How do we start? We start with collecting the data about the patient, the users, the suspected COVID patient. We register them in our platform. We assess their risk, and then we assign them a personal care coach who takes care of each and everything. And this care coach will get them psychological services, whatever the support they need. This care coach will work with the patient to get them the right services. If they feel there is a need and it requires further escalation, they will escalate it to a doctor. And then the doctor will talk to the patient and decide whether we should continue treating them or the patient's health is deteriorating and they should go to the hospital. That's the process. We have, when doctors look at our patients, they have all the information at one place. As you can see, how the temperature is changing every day. We are tracking it 3 times. So it becomes a very, very comprehensive tool for doctors to be able to help their patients. Who is this program for? For organizations to control the spread, company staff to get less infected and help the patients with the necessary support. So it really helps companies to manage their entire staff. There are 4 main parts of the program: symptom management, which is key symptoms of COVID, like temperature, oxygen saturation, those kind of things. How do we manage them? How do we educate people about COVID? Because the one thing which we have realized over the last 5 months, that it's a very, very dynamic situation which changes very, very fast. So we need to be constantly educated and related to what's really happening, and not only the patient or the entire family should know about what is happening. And psychological support, I think we all have talked about it, and Yvonne will talk about it more. And once these 3 are there, there has to be a streamlined communication with the clinician and the patient. So we know which patient is at what kind of risk. We categorize their risks to high, medium, low, and depending upon their risk, we manage them much, much closely. In symptom management, we run 3 times a day health checks. We collect their data, and we have our assistive support in which we guide the patients for the data collection of their vitals. If they have any questions, they can talk to our clinicians and we respond within 10 minutes for any questions. So, and we also have trained doctors and nurses to be able to help with the situation. And we can also deploy more doctors and nurses as required. We work pretty closely with our partners. So when we work with companies, it's pretty frictionless. Within 24 hours, we can deploy a solution for companies so that all of their members, all of their staff members can be easily monitored. We start by understanding what is required by the company, which is mostly pretty standard. Then we quickly implement for a initial set of users, and then we just deploy in multiple sites if required, or we continue working with one site. So with that, I will stop, and I will be happy to answer any questions in Q&A section. What we will say is we have all the tools, people, and support to help the organization with their fight against COVID. Thank you very much.
Thank you, Mr. Prem Sharma. That was indeed really one of the quickest and the shortest presentations which I have seen, yet very crisp and engaging, and telling us what all we can expect out of a technology platform like this. And I think I can, if I can say, I boast of seeing this technology through your team members, and I was really quite impressed by the kind of 360-degree approach which you've taken towards COVID management.
Thank you.
Thank you. The format which we will take is we will request all the 3 panelists to speak quickly with their initial remarks for 2 minutes, and then we have some questions which are already there with us, which we'd like to put up to the panelists, including Mr. Prem Sharma. And thereafter, we will also like to take the questions from the audience. And since all the participants can hear me as much, the attendees, you're requested to put your questions in the Q&A or in the chat section as we go along. So I'd like to start with the lady, Ms. Yvonne Biggins, for your initial remarks on, tracking and managing and monitoring COVID, especially from a mental health care perspective. Over to you.
Thank you. So the brief I had was to talk really about how to keep calm in this COVID time. So are we still good to continue in that vein?
Please.
Yeah. Okay, so first of all, I wanted to start with two quotes, actually. One is from William Shakespeare in Hamlet, and he says, "Nothing is either good or bad, but thinking makes it so." And the second is from William James, who's viewed as America's first psychologist. And he said, "My experience is what I agree to attend to." So both quotes essentially illustrate the power of the mind over our thoughts, over our experiences. And in other words, our experience is what we decide to pay attention to. So in this COVID time, for example, if we pay attention to the news 24/7, if we're constantly checking our phone, if we're constantly on social media, if we're following stories that are not necessarily factual or very negative, then that will become our experience. So we might feel things are not in our control if we do that, or we might start to experience worrying thoughts, or perhaps some anxious thoughts. If, however, we decide only to watch the news once a day from a credible source and spend the rest of the time doing things we enjoy, going for a walk, spending time with friends and family, with socially distanced measures in place, of course, then that will become our experience. So we'll likely feel more in control, less anxious, more cheerful, having a nicer time generally. So the first piece of advice on staying calm in this kind of crisis is only to check the news once a day from a credible source. Negative news stories, they only fuel our innate negativity bias that we have as human beings. So this negativity bias has been very helpful for us in the past because it's kept us safe from danger. But in today's world, it can sometimes create a lot of stress for us. So Dr. Rick Hansen, he's a psychologist from the US, he explains that negativity is like Velcro and positivity is like Teflon for the brain. So when we experience something positive, it tends to wash through us. We don't tend to sort of grip onto it or notice it. But if we experience something negative, it's much easier to grip onto it. So a negative news story about COVID is much easier for us to think about that and to become more interested in that. So it could be a news story, it could be a negative thought, it could be someone else's negativity. So someone else's negativity can be very contagious, as can someone else's positivity. But luckily, there's things that we can do to combat the negativity bias, like expressing gratitude, a mindfulness practice. And psychologists call this really kind of capitalizing on the good. So really kind of hunting out some of the good things, because there are equally as many good things as there are bad things, even in this pandemic. Do you want me to continue?
We should be back with you with more questions.
Okay.
And
yeah, I wasn't sure how much time you wanted me to talk for.
Yes. Thank you. I just thought maybe quick 2 minutes to 3 minutes opening remarks could actually set the ball rolling.
Sure.
And with which now it takes me to Dr. Vardhan. Would you like to give your opening remarks on the technology versus COVID and how you're kind of engaged in it, Dr. Vardhan?
Since it's a chamber of commerce, I would talk from the perspective of the industry. When it comes to COVID, government is managing a COVID crisis, but on the other side, there is industry which has to manage how to operate the industry, how to operate the businesses, how to operate your enterprises in this pandemic. And if you see during the lockdown, everything was closed. Now we are going to unlock 1 and unlock 2.0. So with so many constraints and the cases increasing like exponentially, today it is about 8 lakh cases which are tested positive in India, and it's only supposed to go high. So for industry, it's a big challenge on how to manage this, because we keep hearing any cases in the industry is affecting the business, because either government is coming on the industry and saying that since the positive cases are there in your factory or in your enterprise, so you have to close this. The other thing is how to get people to work there, because how do you know who is positive and who is susceptible, and who can come and work in the industry. So these are a lot of challenges which industry is facing. Government has given a lot of guidelines on how to open up and to monitor that. But what is the tools? What is the digital tools or the system which can help industry manage this? So we thought about this from day-to-day perspective on how to enable industries to manage this crisis from the perspective of management. And the system which Prem showed, it's a unique system which can be used both by the industry and by the hospitals, or even by the governments, to manage this whole situation. And what I want to tell is, we have an industrial solution, which I will keep talking later, but through which the management can monitor the people who are coming to the company for work, if they're at high risk, or if someone has symptoms who has to be isolated, and also to analyze and see that who are not at risk, who can come back to the industry and work. So it's a tool which industry would need continuously for some more time till either vaccine comes or we develop a sort of herd immunity. So the need for it will keep on increasing as the day goes by. Because if you see, recently there was a paper published from MIT, from which me and Prem come. So they're predicting if there is no vaccine by September, there will be like at least 200,000, 2 lakh cases per day in India. So it's going to be huge. So at that time, you need to know like who is at risk, who can come to the work, and who has to isolate themselves at home. So everyone needs a tool, and our industrial product exactly does that. It's a very simple tool to manage, which we can give to the employees and both the management, which can be used to track the 3 T's. Number 1, track and test and treat these employees. So we can deploy that for the industry.
So thank you, Dr. Vardhan. I think that was quite focused, and as you rightly said, as we enter Unlock 2.0, while the cases may be still going up, because we need to balance between lives and livelihoods at the end of the day. It will become very important not only for individuals, but also for organizations, to make sure that when they open up, they do not open up the employees and the entire ecosystem with any risks. So it could be a good handy tool. I'll come back to you with more questions on that. And before which, I'd like to quickly go to Dr. G.L. Agarwal and request him for his quick 2 minutes opening remarks.
Good evening, everyone. Are you hearing?
Yes, we can hear you. Please go.
Yes. Good evening, everybody. This COVID-19, our subject is the trace, manage, and monitor. About this, all the industrial houses and government is doing a lot of work. Apart from this, social activities is helping in different ways. They are distributing all these rations and giving the help in the police department and outreach to all these slum area and rural areas. So there is a lot of contribution of the social activity also. As about the our Social Action Foundation, we are already working in the HIV/AIDS migrant DI programs since the last 10 years. So that we have complete this position how to trace and how to survey the peoples, because in slum and rural area, many people are not literate as well as very poor also. They are unable to take the proper health services So all the social activities, doing proper helping as well as services to them, how to reach and educate to them also. Apart from this, our this SIVS migrant tent, we are catering 16 lakhs population area in South Delhi. And in 10 years, we have given a benefit to more than 20 lakhs and giving all the facilities, proper timely the health camps, health services, and other requirements. So social platform will do the help in the tracing and survey of this. Thank you.
Thank you very much, Dr. Agarwal. I'll request my colleague Ravi to actually speak to Dr. Agarwal and also check. I think he's logged in through two devices. With the result, there was a little echo.
Sir, I have just removed the second one, so we cannot hear the echo.
All right. Thank you, Ravi. So I think I will get on to the questions quickly, which we have been given. So I think my first question will be to Dr. Subramanian. Dr. Subramanian, seeing the role of technology and as a chairman of the health committee, we've also done programs on telemedicine and digital health going forward. So how do you see a role of an app like this or a software like this which can help or support the hospitals and the patients and the entire ecosystem?
See, I must congratulate all the speakers for having put across their point so briefly and so well. To begin with, when you were talking about the role of a virtual day-to-day care, as Prem Sharma put it so well, I think it makes tremendous sense that you are able to have a fairly close enough monitoring without exposure to anybody else, and yet providing the quality of monitoring that is required, number one, to assess if you need enhanced care, or number two, to see if you are safe enough the way you are. And like he said, it does not necessarily apply only to the COVID management. It is something which can extend its role substantially in several chronic ailments. So that, I think, is a very, very positive factor. And I think Ms. Biggins, I think nobody could have put it better when you said only once, and that from a credible source. I think that has been the biggest killer to most of us. Watching news channels all day, news pouring in from all dimensions, many of which cannot be substantiated, I think has been a big challenge. Again, Dr. Vishnuvardhan, when you talked about the magnitude of what the disease could be in the absence of an early introduction of the vaccine, I think, again, we will be completely overwhelmed if we were to depend purely on physical examinations, physical connect, and physical contacts. And I think Dr. J. Agrawal again brought in a very, very brief and yet a very wholesome kind of dimension to it. So I personally believe an app like this has a tremendous application to providing not only healthcare in general, but even when you look at monitoring the normal elderly at home, even for that, I think it becomes a very, very important dimension. So I personally think this is going to be extremely useful. Extending the concept to the telemedicine today, telemedicine has existed for a very long time, and yet one of the benefits of the COVID has been it has accelerated the application and the utilization of the telemedicine platform, both by the patients and by the physicians to a much larger extent. So I think it definitely is far more convenient for everybody in terms of seeking consultation, and without having to travel long distances. And consequently, it will probably encourage people to seek consultations more promptly and more regularly. So I see a tremendous potential here. Thank you.
Thank you very much, Dr. Subramanian, on that highly optimistic note, on the sheer fact that there is something now here which can help us, monitor things, not only for COVID times, but also for the non-COVID times. Hopefully we get into it sooner than later, as well as, taking care of the elder people or the older people, the geriatric healthcare as we talk about it. So I think that there again, it will be a very, very useful tool, a technology tool. Can I go back to Ms. Yvonne? Ms. Yvonne, my question to you is, how big is the typical role of mental health in the CovidCare platform, and is it something which is also available, or is it a big focus area, starting from the detection or getting any symptoms, etc.? How does it work around?
Yeah, I mean, it's a big focus area. DayToDay has a holistic approach to looking after patients, whether that be, more complicated procedures like Prem explained, or this COVID situation as well. So mental health, it can be proved to, if you have a positive mindset and if you have positive strategies that you use for your mental health every day, there is evidence to suggest that that can actually prevent a lot of mental health conditions from actually, starting in the first place. And, what we do at DayToDay is we create education around this for our patients through videos, and then we help them to actually take action, because you could know all the theory in the world about improving your mental health, but if you don't actually take the action, no change will happen. And so we have breathing exercises that can really, they've been proven to tap into the vagal nerve and to sort of really start to kickstart that parasympathetic nervous system, so that you get into a sort of rest and digest state rather than fight flight. Many COVID patients are in this fight flight state constantly, whereas, with these guided breathing exercises that we have within the app, patients can actually start to become a little bit more rational rather than irrational, with their thoughts, and much calmer and much more in control of what's going on. So we have guided breathing exercises, we have lots of education, and we also have our care coaches who, sometimes it's just about having someone reassure you, human to human, that everything's okay. And so they're trained in compassionate communication, and, they can ask questions of a patient and reassure them, acknowledge, how they're feeling, not sort of dismissing the emotions that they're feeling, and helping them with strategies to overcome those thoughts and emotions as well.
Wonderful, wonderful. I think I touched on some very important aspects, and I think Dr. Subramanian wants to say something.
Yeah, I think, this is a very, very well-made point by Ms. Biggins. Apart from what we realized while treating COVID patients was, in addition to those who are tested positive, who may or may not be symptomatic, I think the level of stress amongst even the healthcare workers, was so large. If I had to put all the dimensions of preparing for a pandemic like this on the one side and balance it on the other, with the need to de-stress, I would feel that was the bigger challenge when you dealt with younger colleagues who were actually looking after the COVID patients. So I think extremely well-made point. I must compliment you on this.
Thank you. And just couldn't agree with you more. And we actually have our program for healthcare workers, because we understand the stress that they are going under themselves, and they have kind of compassion fatigue, and it's very important to recognize that. And we have strategies and educational tools to support them also. Thank you.
Thank you.
I'll like to take a quick opportunity here to, actually salute and thank, all the healthcare professionals in the world, who during these times are risking their own lives day and night. And apart from the psychological problems, the physical problems which they go through, I've heard of instances where, the landlords are asking them to shift out, or, they're having to take cabs from one place to another. So I think a definite salute to all the health professionals, which we all need to uh, acknowledge and admire at every stage as we go along this COVID curve. That takes me to Mr. Prem Sharma. I'd like to know the typical role of AI, how is that helping at the back end if we are working around that to get some better results out of this?
So let's take a simple example. Let's see, like, if we are talking and we are doing this Q&A. There are and there may be like a 6-year-old sitting here, and the role of as we ask more and more questions, as like, let's say with this conversation goes for much longer, for weeks, the person sitting there will start understanding that if this is the question, in this cases, this may be the answer. So what happens is now is, rather than somebody professional answering the question, this person learns, and this person says like, okay, now I can tell you, because this question has been asked 1,000 times before, and what I have seen is within this situation, this is the answer which you will be looking at, and this may be the and the person will start suggesting. So which means is like, now what you have, and this is the similar thing goes on with the machines. Is initially you start with something very simple, and eventually what happens is the machines start learning of what is the decision making, how things are changing, how people are behaving, what are the things what are the factors changing the things. So, and that's how that's what we call artificial intelligence. The reality of the AI is like, when you start, it is something very simple, and then eventually as things grow, we learn more and more. In our case, we use a lot of intelligence and risk detection, so that we understand is that if these permutation and combinations are happening, the patient is at much higher risk. And what we have learned is that over a period of time, if these 3, 4, 5 things are happening at the same time or within a proximity of a patient, the risk is much higher. So and which stops people from like, as we know in healthcare, if you find a problem earlier, you can solve much earlier. If the problem is left alone for much longer, so it really helps us to drive the outcomes by finding the problems much earlier.
Great. Thanks, Mr. Sharma, for this. And my next question is to Dr. Vardhan. In a situation, I think managing crisis is a very important aspect. And considering that a person is got indications which are very strong COVID indications, how does this response system, especially the crisis response system, work on the platform like this?
Yeah. In the platform, we have built a risk assessment system, and also I will make it very simple. Any person who is registered on the platform is automatically given a risk. Like, say, if they're at low risk or moderate risk or high risk. It's based on the algorithm we have. It's a kind of decision-making tree where, based on their health parameters and their clinical symptoms and signs and few questions we ask, we categorize them into 3. If it is a low risk or a very mild risk, then what you need for these people is to just keep in touch, monitor them, so that when they go into the high risk, when they develop symptoms, or when they have any other problem, you detect it early. So other than that, you're not doing much. But when it comes to moderate, so you are again monitoring in a more intensive phase. We have a concept called active and passive monitoring. Usually when a person is having a moderate or high risk, we start that phase of active monitoring, where we push in more questions, we talk to them more, or we monitor them in frequent intervals. And the last part is high risk and emergency. So if it is a high risk, then this whole remote monitoring doesn't work for them. So they have to be in the hospital. They have to be monitored in physical space. So we detect it in the first instance itself. We say that this is the person who has to be in the hospital. Now, if you see what is happening in real, it is all jumbled up. So a person might be a positive COVID, but he might be having a very mild symptoms. Still, sometimes he is put in a hospital. Sometimes you are seeing this news every day that some person was high risk, he was having breathlessness, he could not get a bed. So this is all jumbled up. So who needs this care has to be systematically done. So if you see from the tools which government or any organization has, they don't have these tools. So it's all randomly done now. So that's where we call it as a system thinking. What Prem started in the beginning, that we are trying to give it tools where they can be systematically monitored. So this is where this AI or analytics also come, because it's not manually done, where a person has to sit and go through each, like say I have like 10,000 patients in the system. If it is to be done manually, then I have to go to each person and see it. Here the system does it, so it becomes quick. So even if there are 1 million people in the system, it can easily tag a few high-risk patients and the emergency patients, and then direct the system to manage them, and the others can be kept in the remote monitoring system. That's how it works. So it works on a scale. If it is 10 patients, 100 patients, you can manually do it well. But in this scale, where like there are every day thousands of patients have been diagnosed positive, and we have to manage them. So there has to be a system which can do it rather than physically doing it. So that's where we come in, and that's the where our solution comes in.
Yeah, thank you, Dr. Vardhan. I think that's a very, very important aspect, because I think that's the time when people start to panic and really don't know what to do. So if you have a system like that to support you, it can definitely bring some calmness and, mental balance, as I would like to say, to actually work in the right direction. And that's where team from Miss Begins also be probably supporting the patients. And more importantly, sometimes the family of the patients, because they panic as much equally. Not only of the scare of getting infected, but also of the scare of, how are we going to treat him now? So with that, I'd like to take my next question to Dr. G.L. Agarwal. And Dr. Agarwal, my question to you is what are the most effective methods of, you think, increasing involvement and support for the education of BPL youth, because I think below the poverty line, the youth are again the ones who are a lot more restless, and they would move out, at the slightest instance of the unlockdown. So would you like to give us some idea on that, Dr. Agarwal? Dr. Agarwal, can you hear us? Okay, I don't seem to be able to get through to him. So I'd like to now quickly take some questions which are happening by the side, apart from those excellent compliments which we are getting, um, which are there in the box. Yeah, we can't get it. Yeah, Dr. Subramanian, you wanted to say something?
Yeah, Vivek, much as I really enjoyed being a part of this, I've just been called away. So can I excuse myself, please?
Yes, yes, please. It's totally understandable because patient care is a lot more important. Thank you very
Thank you, sir.
Really,
Thank you.
we're really honored by your presence.
Thoroughly enjoyed, and compliments to all the speakers. Thank you.
Thank you.
Thank you, Dr. Subramaniam. Thank you.
Bye. Bye.
Thank you.
So this question is to Mr. Vishnu. One of the attendees wants to know that his understanding is that the product or platform is basically for organizations who resume the work in a common physical space.
Yeah. This is for like we have a COVID industry product, which we specifically designed keeping in view what are the challenges industry would face when they open up. Like say, if it is an MSME who has to start the production, or if it is a heavy industry which has to again start the full production, or even a working space where there are a lot of people working. So there are different kinds of enterprises which will be doing business. And once they start, so there are many things which have to be kept in mind, like how do you assess the risk of your own employees who should be coming and working? And after they start working, how do you monitor them every day so that person who has COVID or starting to develop symptoms is recognized by the system early, and they're taken care rather than they come to the organization and then spread the infection to others. Now, if you're seeing the latest research, it is saying that COVID can be airborne. Airborne is a totally different problem than what we are facing. Airborne, the infections will rise when they're in a closed place where there is not much ventilation. So that happens in virtually every place where there industry or a co-working space or an office where a lot of people are sitting and working or working together. So there the chances of spreading of infection is more. So what we can do to help these organizations is identify the people who can be given a green signal to come and start working, and people who have to be monitored or isolated or told to take care of themselves. And even also many organizations can have people who are at high risk, who are not supposed to be outside. Like say somebody has a diabetes, somebody is more than 60, somebody has other comorbidities. Organization will not have a tool to identify them. So we can ensure that and see that like these people are at high risk. How do you want to do with them? So do you want them to come to the organization and start working, or you want to make them work from home? These are the different challenges organizations will face. So our industrial COVID is exactly designed to do that. And we also can give the other support, like somebody needs healthcare support, somebody needs support from the mental health or well-being point of view. All these are part of the solution. So this industrial COVID solution is specifically designed for the industry. So we have all three kinds of solutions. One for the government or very large healthcare organizations who are managing COVID patients. Other is for individual hospitals who want to remotely monitor the patients. And third is for the industry, specifically designed.
So I think that's quite a good understanding. And there happens to be a question on, what is the stage of development of COVID vaccine now? I don't think we can answer really something like that, but all what we know is from reports, basically from newspapers, and we will leave it at that. I'm just wondering if Dr. G.L. Agarwal is back, and if I can ask him a question, or otherwise we will continue with questions to the other panelists. No, I don't think he seems to be still having a technical problem, though we would have loved to hear from him, especially on the activities as an NGO which he's been doing, and how is he managing the BPL youth and even other aspects of it. So can I come back to you, I think, let me go back to Mr. Sharma, Mr. Prem Sharma. Uh, we've understood, we've heard that, this particular platform is good for corporates as much for individuals and families and all. So how ready are you in terms of giving it to corporates and other organizations? And how can the HR personnel adequately address the needs, of individual patients and an organization? So can you just give us a little more perspective on that? And can we go can we start, let's say, as good as tomorrow?
Yeah. So we are a turnkey solution, which means we can start right now. As long as all we need to start is a phone number of the person, and we can start within seconds. The whole platform has been ready, so it's literally a turnkey solution where you just have to you go into a car and you just turn your key and car starts. We are at that stage. Everything is set up, everything is ready. We have the workforce behind it, so literally we can start as soon as 10 minutes.
Oh, that's great. That's great. And I know you already offered it on a complimentary basis for individuals who are the members of PhD Chamber. So I'd just like to thank you since you're the founder and the man behind this. So I'd like to thank you for that offer which you have given for PhD members. And all those members who are listening, you could avail that and offer, and all those non-members who are listening to that, they may have to pay a special price for it, or alternately become members of PhD quickly to get a free version of that. That takes me back to Ms. Biggins. I'd like to ask you that, the care which is given by the coaches and the experts who offer this care, how are they typically dealing with different needs of different people? Because it's if you look at the permutation combinations, it can be it can run into millions. So you can understand a part of it is being taken care of by AI, but then at a one-to-one level, how do they really manage that? And then maybe a patient says, hey, why don't you talk to my brother also, or why don't you talk to my mother? So can you just throw some light on that?
Yeah, the first level of support is definitely within the app, and there's foundational kind of resources in there, like I said before, to help patients and also to help their families and caregivers as well. When it comes to the coaches, it's like any form of mental health. Everybody has their own unique situation that they're coming for support, to see somebody for support. So with the care coaches, they're trained to just listen, acknowledge the emotions, and provide strategies that are kind of universally applicable to many different people. And some strategies will work better for some people than others. And so they will discuss those, with each patient. So there's kind of a person activity fit in terms of strategies. So that's where the kind of personal approach comes in. But then there's also a certain amount of patient choice as well, in terms of, and patient agency in terms of knowing, what sort of activities will work for them within the app and also through the care coaches. If there is a kind of very significant mental health problem, then we would refer them on to a psychologist to really kind of diagnose that further and assess the type of intervention that's kind of appropriate for that patient going forwards.
Okay, I'd just like to extend that discussion a little bit more. As you said, the first cut level of support is of course available through the app. But as you said, human to human interface is very important. So let's say a patient gets to realize that after his test he's positive and he panics, so he probably, or he or she may not have time to go to the first stage or the second stage. So can I kind of push an alarm button there and say, hey, I really need to talk to somebody, because I'm petrified and so is my family. where do I get a bed in the hospital? So he may have 30,000 questions. So do you think the app will take care of that and the support system behind it?
Initially, we would kind of, assess the need of the patient via the app and via chat features within the app. And then if a patient needs to speak to someone, of course, we would, speak to them, and our care coaches are trained to do exactly that, to help them, to signpost them if they need further support, to reassure them, to really kind of put their mind at rest. So that really is their role.
Right. And there's another aspect to it, I've heard of a lot of cases where people are not infected, but just the fear factor itself is working, detrimental to their thinking process and their thoughts. They're too scared. I know of my own daughter, who's petrified, then she would spray on any packet which would come home, she would spray it 10 times and panic, So
Yeah.
Are there some support systems for cases like those? Because those may not be patients, but still fight.
Yeah, there's lots of exercises and strategies. I think, that's kind of, it's tapping into each person's kind of coping style. And the situation that you've described there is that, somebody very much wanting to be in control. And with this pandemic, none of us are in control. We don't have all the answers. And that's something that we need to adapt to. As human beings, we're very good at adapting. But we do need coaching and guidance. And, that's what the care coaches are there for. And also we have exercises, within the app that can help with that sort of situation. So it sounds like a sort of catastrophizing sort of scenario that you're describing. And one of the activities that we have is an exercise called putting it in perspective. And in that situation, you think of the worst possible case scenario, and you think of the best possible case scenario. And then you think about, well, what's the kind of middle ground here, the most likely scenario? And that just helps you kind of move your thoughts from irrational to rational, exercises like that. That's one example of an exercise in the app that can help, or an exercise that a care coach can take a patient through. But if it turns into more of a kind of psychological mental health kind of condition, that's when we would escalate and refer on to a psychologist who can support further, with like OCD, for example. If that really kind of manifested itself into a mental health condition, that's when we would refer on to specialists.
Right. So I think I must take a moment to congratulate Prem and of course all the people behind this, because as I see it, correct me if I'm wrong, Prem or Dr. Vardhan, since you're the people behind the entire technology, that it's not only meant for patients today, it's meant for a whole lot of us out there, patients' relatives, patients' friends, or even general family members, who are kind of being cautious or overcautious or trying to manage their day-to-day lives in homes and even outside homes. So,
Thank you so much.
am I right in saying that, Prem? Yeah.
Yes, absolutely. So even when our main acute care product, what we have seen that half of our users are the family members of the patients. So because it's not like the one thing which which we have observed, and it's a common knowledge, but we sometimes forget that people are not alone. So when a patient is being treated by the doctor, it's not only patient's life has changed, it's the family's life has also completely changed. And sometimes in healthcare problems like cancer, family goes through like a similar trauma as the patient goes through. So not only the patients have to be supported, but the families also have to be supported. And that's where we come into, how we organize everything, that not only the patients, but the families are also supported. They go through coaching, they get all the support, they get all the information. Half of our questions comes from family members of the patients.
So great. And I don't know if I can still make a last attempt to get Dr. GL.
Yes.
Okay, Dr. Agarwal, we were missing you probably because of reasons. I'd like
Technical
to
problem.
definitely, since we are running short of time, but I definitely want you to answer one very important question which we had from one of our viewers earlier. It said, basically, what are the most effective methods of increasing involvement and support for the education of BPL youth, you know, the poor youth, the youth at large, and who would find the slightest instance to move out of their homes, either carry infections as asymptomatic. So how do you manage to educate and involve them? Because they could be an important aspect of spread or no spread of the COVID.
Vivekji, we are already working this education in the BPL areas, especially in this nursing assistant course we are providing. The girls and only girls, those have not passed 8th or 10th. Already we have given 3,500 girls as a nursing assistant course for 6 months. 5 months academic or 1 month is this hospital training. They are earning monthly minimum 25,000 rupees. And in this COVID area of days, they are earning 70,000, 75,000 rupees. So that they are helping the health sector, the society, as well as their family also. So that it requires a lot of this education, because awareness and education of people is most important aspect, so that they can care themselves. So we are working already, and we are expanding these things. So this is most important things. Thank you.
Wonderful, wonderful. So that's great to know, you know, because how you are actually using the youth there, you know, especially the girls, and who are not so educated, to kind of, you know, help the overstressed healthcare sector. So thank you so much for that. And I don't see any more questions as of now in the chat box. And it's also that we are running out of time. We're already about 20 minutes over our scheduled time. But I'd like to really thank Mr. Prem Sharma and Dr. Vishnu Vardhan for being here this evening. And I know I think it's the same Sloan, which is also very well known for treating cancer, if I'm right.
Sloan is known for a lot of innovations. Yeah.
Yes, yes. So, and it's the topmost institute for, I know of some patients who are, as we speak, are currently getting treated there. And it's good to see both of you coming out of a reputed institute, thinking of things at large for the benefit of the society and benefit of mankind, especially in these pandemic times, you know, because technology is going to be a very, very important tool to actually be able to manage things. As Dr. Vardhan said, if it's 10s or 20s or 50s or even 100s, you can still manage through, you know, manually. But when it gets into millions, it gets very difficult. And I'd like to thank Ms. Biggins, Ms. Yvonne Biggins, for being here today and really helping us, you know, understand and figure out what are the important aspects of the mental issues which the patients face and how the technology can really help them. And thank you, Dr. G.L. Agarwal, for being here. And I'd just like to also thank our media partners like Medgate, Drug Today, and Pharma Tutor for their support to actually make this conference, this webinar, a great success. I'd like to thank Dr. Subramanian in absentia for, you know, giving us that hope factor. And since he handles a big chain of hospitals, you know, I think his views are very, very encouraging that, you know, things or technology like this can help take this forward. So with this, I would like to formally close the webinar with thanking everyone for being here this evening. I can
Thank
see
you, Vivek.
say something.
Thank you. Thank you, Vivek. Thank you so much for organizing this. It has been a really good discussion with everyone. And I would also like to thank PhD leadership for all the kind support we have been getting from day one. For a company at early stage, like it relies on a lot of goodwill and a lot of support from the society, and we are very thankful for all the support we are getting from PhD.
Thank you. And I want to especially thank Dr. G.L. Agarwal, our member of the managing committee, for being here. For those who do not know what is managing committee of a chamber, it's like a board of a company. So I would like to thank Dr. G.L. Agarwal for taking out time to be here and for all the beautiful things which he does, through his societal activities, and social work which he does. Thank you, Dr. Agarwal, for being here.
Thank you, Secretary.
Thank you.
Thank you. Thank you so much. Thank you, Dr. Vardhan. Thank you, Yvonne.